Good morning, friends. This is Dr. Anugraha here, and today's topic is teratoma. What is it here? Teratoma. Now tell me, see, this is an important question from your pathology as well as your OBG. Now tell me, what is teratoma? See, it is a tumor. Okay, this is a tumor of the germ cells. I'll tell you what are germ cells. But first point, what is teratoma? It is a tumor of the germ cells. See, teratoma, it comes from the Greek word. Teras means what? Monster. Okay, it means monster. And oma means tumor or a mass. Now, this is called as a monster because grossly when you see the tumor, when you see the tumor, it looks like a monster. It gives you a weird appearance because it has got different kinds of tissue. You can see teeth here, you can see hair here, you can see sebaceous glands here, fat here. So you can see different kinds of tissues in the tumor giving you the monster appearance. That is why it is called as teratoma. Now, let's come back to the definition. I told you teratoma is what here? It is a tumor of the, it's a germ cell tumor. It is a tumor of the germ cells. Now, before I tell you what are germ cells, you must know that our body is made, all cells of our body, every organ of our body, it is made from 3 layers, either of the 3 layers. So, the embryo is made, the embryo's organs or us, we are made from 3 layers. When we learn embryology, I think I put up a class in embryology as well describing all these. So as of now, remember that all parts of the body, they are derived from 3 layers. Okay, I'm talking about embryology, development part. We have ectoderm, we have mesoderm, and we have endoderm. Okay, so this ectoderm layer, it gives rise to what? Skin, brain, nerves. The mesoderm layer, M for M, it gives rise to muscles, the bones, and endoderm layer, it gives rise to the GI tract, it gives rise to the lungs, the liver. Alright. Now, why did I talk about endoderm, mesoderm, ectoderm? That's because, see, I'll talk about germ cells and then you will know why I told about these 3 layers. See, girl or boys, I take class for a girl here, so yeah, it just automatically came. Okay, girls and boys, listen. Let's see, these 2 are the ovaries. Okay. And inside the ovaries, we have got what are these that I have drawn? These are the germ cells. So inside our ovaries, we have what, guys? Germ cells. So these germ cells, so at birth, inside ovaries, we have got about 1 to 2 million germ cells. Alright. And over time, once a girl reaches puberty, see, teratoma, they usually ask you about ovarian teratoma, that's why I'm talking about this. Okay, so once a girl reaches puberty, some of these germ cells will undergo degeneration and about 3 lakh germ cells remain. Okay, after that, she attains menarche, she starts getting her periods, and from each ovaries every month a germ cell is released. You know what? See, when a germ cell is matured, what do we call it? When a germ cell gets matured, we call it as the ova, the egg. Okay, so germ cells in females, they become the ova. In the testes, in males, what do they become? The sperms. Okay, so in the testes, the germ cells are what, guys? Spermatogonia. Okay, now remember, see, when the ova and the sperm fuse, we have the embryo. And embryo, I told you, embryo, it has got these 3 layers, ectoderm, mesoderm, endoderm, that forms different parts of the body. So what I need to say here is the germ cells, whether be it ova or be it the spermatogonia, they have the ability to form. Yeah, that was my driving teacher. I have started to take driving lessons. Okay, where did we stop, guys? So remember that, the ova or the spermatogonia, they are pluripotent. When I say pluripotent, it means that they have the ability to form any of these 3 layers. Okay. Now, if the germ cells undergo abnormal proliferation, it can lead to what? Tumor. So I told you germ cells are pluripotent. They can form ectoderm, mesoderm, and endoderm. Right? They have to form the embryo. That's why. So if they undergo a abnormal proliferation, they can form what? Any of these 3 layers, and I told you These three layers give rise to different parts of the body like skin, brain, bones, muscle. That is why such a tumor, a teratoma tumor, has got multiple tissues in it. Understood? This much understood? Okay. See, what I have shown here, it is a picture of an ovarian teratoma. Usually they tend to ask you ovarian teratoma. You can see teeth here, right? You can see hair here. So this is an ovary. Okay, look at this picture. Again, this is an ovarian teratoma. Now, you can see hairs here, right? And there could be cystic fluid accumulation as well. So here, just one liner. A benign cystic teratoma is also called as a dermoid cyst. Don't go too much deep into it. Okay, it might come as a one-mark question or as an MCQ. So a benign cystic teratoma is called as what? It's a reminder dermoid cyst. Now remember, teratoma can be mature teratoma or immature teratoma. See, mature teratoma means it is benign. Okay, that's all you should know. Mature teratoma is what? It is benign. If somebody tells you, this is immature teratoma, then you will remember that it is malignant. It is malignant. Okay, so how will you remember? See, immature has got two M's in it. Okay, so that is malignant. Remember that, huh? So you saw the picture. Okay. Now a surgeon has identified that the patient has got what? Teratoma, ovarian teratoma. It is symptomatic. So he or she has removed it, okay, and given the pathologist for an examination, right, to confirm whether it is benign or malignant. Now, see, this is an ovarian teratoma. Okay, the most important part here is a nodule. Can you see this part here? Right? That is called as Rokitansky protuberance. Very, very important. Now, why am I talking about this protuberance? Because this is a site for malignant transformation. Okay, if there are tumor cells, where you can find, if those tumor cells have undergone a malignant transformation, you can see it over here. So what does the pathologist do? She will cut it here and see it under the microscope, right? So if there are malignant cells here, then she will report it as what? Malignant teratoma. Alright, so that is the importance of Rokitansky protuberance. That is a site, that is a nodule where there is a chance for malignant transformation, right? Okay. So you saw this picture here. Alright, clinical features, very simple. That sometimes it is an incidental finding and it could be asymptomatic. It can present as an abdominal mass. Diagnosis, you can do USG, CT, and you can perform tumor markers like alpha-fetoprotein and HCG. Alright, and the treatment is surgical excision. If it is malignant, go for chemo. Okay, see another picture of teratoma. Ovarian teratoma. And now also see not just ovary, even the testes can undergo teratoma. Wherever there are germ cells, there could. I thought I had clicked pause. Wherever there are germ cells, there is a chance for teratoma. So this is a picture of testes which has got teratoma. Can you do one question? Yeah, simple, not teratoma. So see, what is the definition of teratoma, guys? It is a germ cell tumor. Okay, it is a germ cell tumor, and it will have more than or equal to 2 germ layers. What are the germ layers? Ectoderm, mesoderm, endoderm. Alright. Fine. Now read this question. A 26-year-old woman presents with lower abdominal pain. Okay. USG reveals 6 cm right ovarian cyst with echogenic shadows and a Rokitansky nodule appearance. You got your answer. You see this word, what is your answer? It is teratoma. What is the most likely diagnosis? Yeah, it is a teratoma, mature cystic teratoma. Alright. So, yes, that's all for today. I'll see you in the next class. Stay blessed, eat healthy, drink lots of water, and give me the feedback.